Do you know what high blood pressure is and how it can affect your health? Whether you're a fitness enthusiast or an everyday Joe, it's worth understanding. High blood pressure or hypertension is a prevalent health issue that can develop unnoticed. Think of it as an uninvited guest causing harm subtly. But what exactly is high blood pressure? Picture it in this way. Your blood vessels are highways and your blood, the cars on these highways. The speed and pressure with which these cars move represent your blood pressure. In a healthy system, this traffic moves smoothly. But with hypertension, it's like a perpetual traffic jam. This undue stress on your artery walls is what we term high blood pressure, and why should you be concerned? Because this persistent stress can result in various health complications. It can damage the arteries, leading to heart disease, stroke, kidney problems, among others. So, how do we monitor silent trespasser? Regular blood pressure checkups are crucial. Simple and quick. They can be done at any healthcare center. They measure two figures: systolic pressure, the force while the heart beats, and diastolic pressure, the force when it's at rest. Ideally, these should read around 120/80. But if the readings are persistently 130/80 or above, it might signify high blood pressure. In conclusion, hypertension is a silent yet potentially harmful condition. However, with routine checks and alertness, it can be effectively managed. Now that we know high blood pressure is, let's delve into what causes it. Ever wondered what causes high blood pressure? It's a question many of us ask. High blood pressure, hypertension can stem from numerous factors. Some of these factors are due to our lifestyle choices and some are purely genetic. Firstly, our daily habits are a significant contributor. Lack of exercise and poor diet are key culprits. Inactivity means our heart has to work harder, leading to higher pressure. Diet high in sodium and low in potassium can cause fluid retention, increasing blood pressure. Smoking introduces harmful chemicals into our bloodstream, damaging our arteries and raising blood pressure. Drinking excessively can lead to chronic hypertension over time. Beyond our habits, genetics also plays a role. If high blood pressure runs in your family, you're likely at a higher risk. Age is another factor. As we age, our arteries naturally stiffen, which can raise blood pressure. Regular checkups become crucial with advancing age. Certain medical conditions like kidney disease, diabetes, and sleep apnea can also cause high blood pressure. Even stress and certain medications can cause temporary spikes. While these might not cause chronic hypertension, frequent spikes can damage your blood vessels and heart over time. High blood pressure has myriad causes and is a complex condition. Understanding what causes is key to managing it effectively. Knowing the causes is a step forward, but how do we recognize its presence? Let's discuss the symptoms next. High blood pressure can be a silent killer, but how can you tell if you have it? It's a question that might have crossed your mind, particularly since hypertension, frequently referred to as the silent killer, often doesn't exhibit any warning signs. It can quietly harm your body for years before any symptoms develop. Hence, early detection of high blood pressure is vital. You might be wondering, if it's silent, how do I know if I have it? Regular checkups are the answer. Imagine a leaky pipe in a house, subtly causing damage over time. It's not until the damage is extensive that you notice it. Similarly, high blood pressure unobtrusively inflicts damage. Only through routine screenings can you know if you have it before significant damage occurs. But symptoms do exist. In some instances, people with high blood pressure might experience headaches, although these are not specific to hypertension. Shortness of breath is another possible symptom, but it's not restricted to high blood pressure. Nosebleeds can also be a sign, but they're more common in cases of extremely high blood pressure. However, these symptoms can be misleading as they can be easily ignored or attributed to less serious conditions. That's why it's essential to not rely entirely on the existence of symptoms to know if you have high blood pressure. Regular screenings are your best protection against this silent enemy. Understanding the symptoms of high blood pressure isn't just about knowing what to look for, it's about grasping the importance of preventive measures, the necessity of routine checkups, and the severe potential consequences of negligence. Now that we the symptoms, let's talk about the effects of high blood pressure on our bodies. High blood pressure isn't just a number, it can have serious effects on our health. It's a critical condition that can severely impact our bodily systems. Initially, it can cause damage to our heart and blood vessels, resulting in a condition known as atherosclerosis. This situation can reduce the blood flow and potentially trigger a heart attack or stroke. Furthermore, high pressure can lead to heart hypertrophy, making the heart muscle thicken and increase the risk of heart complications. Let's shift our attention to the brain. High blood pressure can cause strokes by impairing the blood vessels in the brain. It disrupts the blood supply, causing a myriad of neurological problems such as speech difficulty, paralysis, and memory loss. Next, let's discuss the kidney aspect. They are our body's natural filters. High blood pressure can damage the blood vessels inside, leading to kidney disease. In severe cases, this can result in a dire need for dialysis or a kidney transplant. Short, the effects of high blood pressure are wide-ranging and can significantly impair our quality of life. On a brighter note, these complications are largely avoidable. Early detection of high blood pressure can aid in preventing these complications and safeguarding our health. Regular checkups, a healthy lifestyle, and proper medication can help maintain normal blood pressure levels. So, it's not just about dealing with a problem but taking preventive measures to avoid it in the first place. High blood pressure can have serious consequences, but the good news is, we can take steps to prevent it. Let's pledge to lead a healthier life for ourselves and for our loved ones. Prevention is better than cure, isn't it? So how can we prevent high blood pressure? Indeed, this isn't about complex medical procedures or secret formulas. It's about adopting a few lifestyle changes. Let's delve deeper into what these changes entail. To begin with, one must focus on maintaining a healthy weight. Obesity has a direct correlation with high blood pressure. If you manage to control your weight, you are already making strides in preventing hypertension. Next, we look at what we put on our plates. A diet is of utmost importance. Ensure you incorporate fruits, vegetables, whole grains, and lean proteins into your meals. Sodium, although necessary, can have adverse effects when consumed in high quantities. Foods that are high in sodium, like processed foods and salty snacks, should be reduced or avoided, as this can contribute to high blood pressure. Also crucial to engage in regular physical activities. Regular exercise, whether a leisurely walk, gym session, or dance class, helps maintain normal blood pressure levels. Consistency is the secret to success. Find an exercise regime you love and make it a part of your daily routine. Alcohol and smoking are two habits that can severely affect your blood pressure. Limiting alcohol consumption and quitting smoking can significantly improve your blood pressure levels. It is challenging, but the benefits are tremendous. Also, never undermine the importance of regular checkups and monitoring your blood pressure. High blood pressure can silently damage your body without showing any symptoms. Regular monitoring is vital in detecting any early changes, enabling you to take timely actions. Making these changes in our lives can dramatically decrease our risk of developing high blood pressure and the complications that come with it. So, let's make a pledge to ourselves today to live healthier, happier lives. After all, our health is our wealth, and we must take care of it the best can. By making these changes, we can significantly reduce our risk of developing high blood pressure and its complications.